In the mid-1980s through the 1990s, Uganda was in the midst of the HIV/AIDS pandemic. In the 1990s, the prevalence rate in the adult population was 33%, and this resulted in thousands of deaths and millions of affected families. While the government responded in hopes of containing the pandemic, this general response left out target-specific populations within Uganda which had unique concerns. Key among the concerns was the issue of women and mother-to-child HIV transmission. In the early 1990s, a large number of infected mothers were giving birth to babies infected with HIV, and the seroprevalence among pregnant women was about 30%. To date, national prevalence rates amongst adults have dropped to about 6%, including among pregnant women. But transmission of HIV from mother to baby still continues. The concerns for both the infected pregnant mothers and their potentially infected infants and the gaps in maternal child health services in Uganda intensified the need to reduce the risk of mother-to-child transmission of HIV and drew interests from researchers. Makerere University Johns Hopkins University Research Collaboration initially focused its research on the needs to better understand the risk factors for HIV infection in women and children. Later, the studies were directed at finding ways to prevent mother-to-child transmission of HIV. These efforts produced the landmark intervention with single-dose Nevirapine. It has become the key component of strategies to reduce the risk of mother-to-child transmission of HIV/AIDS in Uganda and other developing countries. The MUJU collaboration has involved both leading Ugandan and American researchers who have been collaborating on this problem since the late 1980s.
We have investigators, physicians, who are both from Makerere University and also from Johns Hopkins, interested mainly in doing research in the prevention of mother-to-child transmission of HIV. But our overall goal is to provide care and treatment and conduct research in the area of mother-to-child transmission and also to take care of families infected with HIV.
Since MUJU's inception, the majority of research conducted has aimed at reducing the risk of mothers transmitting HIV to their babies. One of the landmark outcomes of this research effort was the discovery that a single dose of an antiretroviral drug, Nevirapine, given to mothers at the onset of labor to their newborns could reduce the risk of transmission by close to 50%.
It was a very important clinical study that was done. The results came out in 1999, and they showed that this very simple and deliverable regimen really could reduce transmission by about 50%. So everyone was very excited about these findings, and this regimen is now the cornerstone of giving prevention of mother-to-child transmission in the resource-limited settings such as Africa.
In 2000, the use of single-dose Nevirapine for prevention of mother-to-child transmission, PMTCT, was adopted as national policy by the Uganda Ministry of Health. It has also been adopted by World Health Organization, WHO, as a cornerstone of PMTCT strategies in resource-limited countries. Furthermore, when Nevirapine use is combined with other short-course antiretrovirals such as AZT or AZT/3-TC, transmission of HIV from mother to infant can be reduced even further.
And this reduction in transmission of 50% was a landmark because other studies have not been able to show such a simple regimen to do such a significant intervention. The importance of this intervention is that it's not only being used in Uganda, it's been scaled up in over 60 countries throughout the world. Those are countries which are developing, resource-poor countries in Africa mainly, but also in Southeast Asia and South America.
Mulago Hospital not only provided the setting, but was a partner in this research.
Before the coming of MUJU, many of these mothers delivered children that were infected with the HIV virus. And therefore there was an urgent need to prevent the passing of this virus from the mother to the unborn child. And hence this program of the prevention of mother-to-child transmission was embraced fully by Mulago Hospital when it was brought by our collaborators, Muju.
Today, Mulago has a vibrant PMTCT program integral to the hospital's antenatal care units. The clinics are run jointly by the hospital staff and Muju health workers. These clinics serve as recruitment areas for volunteers for various studies at Muju while providing standard of care, treatment, and support services to the patients. Like most major health facilities, screening for HIV among pregnant women is now routine. Although it allows women to decline testing, incorporating this service as a routine procedure has allowed Mulago to achieve a 95% screening rate of women who attend the antenatal care. This success has allowed many more infected women to revive preventive services to help avoid infection in their infants. The clinics also provide a range of other services to the expectant mothers, including health education. One of the benefits is same-day HIV screening. The expectant mothers first undergo pre-test counseling sessions before they are screened for HIV. Women are also encouraged to bring their partners in for testing and are coached on skills to help talk to their partners about HIV. Couples counseling offers several advantages in that partners can discuss concerns together and with the counselor, improve their understanding, and come up with strategies to deal with the possibility of HIV infection. The woman is then tested and given post-test counseling on the same day. This helps to diminish the anxiety that occurs while waiting for results and helps avoid losing women to follow up who could potentially get tested and not have the opportunity to return. All pregnant women found to be HIV positive are offered antiretroviral treatment to help prevent transmission to their unborn babies. The medications prescribed depend on the woman's length of gestation, her health status, and the judgment of the examining physician. Muju continues to carry out studies that will further reduce mother-to-child transmission.
We are giving prevention drugs. We do not stop there. We also provide HAT. This is ARV for all these women whose CD4 cells are very low.
The focus now is predominantly on how to make breastfeeding safer for the infants of HIV-infected mothers. While single-dose Nevirapine, NVP, has reduced mother-to-child transmission by close to 50%, this does not help stem possible infections that may occur during breastfeeding. Although the use of ARVs by positive mothers can prevent transmission to babies during pregnancy and at birth, it is not sufficient to safeguard the baby from transmission during breastfeeding. Since breastfeeding helps babies to survive and thrive infancy, it is a priority to make breastfeeding as safe as possible.
The single-dose Nevirapine is not able to take care of the transmission through breastfeeding since the babies breastfeed for a long time, 6 to 9 months. So that has been our challenge as well. And what we've recognized that we need to do more research to see if we can further reduce transmission of HIV through breastfeeding.
Breast milk is a lifeline of ensuring the health and survival of babies in Uganda. However, the dilemma of HIV-infected women is that there is also a low but ongoing risk of transmission through breast milk. For this reason, Muju is focusing on studies aimed at making breastfeeding safer for HIV-exposed infants. Muju recognizes the importance of mothers deciding for themselves how to feed their infants. To better support mothers, Muju has a nutrition program and a full-time nutritionist who educates mothers on food supplements for their babies in the absence of breastfeeding and on best practices when weaning infants. Participants in the program are assessed and enrolled depending on need. Mothers are taught about quality nutrients that babies will receive from common foods available in their homes. They are taught which foods they ordinarily stock in their homes are rich in nutrients, and they are coached on using these local foods to benefit their infants.
These mothers are referred from the clinic, the main clinic there. When the babies are coming to 6 months, they come here and they learn how to prepare the food. Because at 6 months exactly, the baby should be starting to eat the family food.
Besides the nutrition program, some participants and their family members receive food supplements. This program is provided by the World Food Program. The program supports 1,000 vulnerable households. This comprehensive approach has been developed to deal with the nutritional needs of the entire family.
Many of the patients we see are from the vulnerable population that are being attended to in Mulago Hospital. Mulago Hospital serves mainly patients from the low socioeconomic status and mid socioeconomic status, and as a result of the devastation of HIV, many of them have lost their jobs. They cannot be able to afford food for their families. So when they come into the research programs and the care programs in Muju, they are given food supplements which also help them to adhere to drugs because they receive food every month. And then the food is given to not only them but also to their members of their family. So that helps them cope with the food insecurity that they are facing as a result of HIV.
Muju is also participating in a safety study for an infant vaccine that could potentially prevent transmission during breastfeeding for 6 months. Although still ongoing, the safety data so far are reassuring. Another study is being carried out to evaluate extended dosing of infants with Nevirapine in the hope that it could help reduce transmission during breastfeeding. The hope is to help increase the safety of breastfeeding from HIV-infected mothers in order to help the babies survive infancy.
We are looking at strategies now that will protect and make breastfeeding safer. Breast milk really is the lifeline for babies to survive. So the current strategies are looking at giving Nevirapine or other antiretrovirals during the breastfeeding period, and to also consider use of vaccines to protect the baby during the breastfeeding period.
For clinical trials to take place at Muju, the scientists rely on the goodwill and voluntary participation of people, also referred to as volunteers. Potential volunteers undergo an intense and thorough informed consent process to enable them to make an informed decision about their participation. Maintaining good relations and sharing information with communities is of paramount importance to the Muju investigators. At every step of the research process, representatives of the communities, known as the Community Advisory Boards, CAB, are involved to ensure the community understands the research. They are the ears and eyes of the volunteers and their families, representing their interests and ensuring that strict ethical standards are an integral part of the research collaboration.
The community is a major component of the Muju research collaboration, and the community members are involved in preparing and reviewing the informed consent, and they provide a critical input into protocol development.
Even after the consent has been given by the participants, routine counseling is still maintained. Counseling takes place at every scheduled visit to ensure that Muju has the continued consent of the participants at each stage of the study. This helps the participants to cope with the emotional, physical, and psychological situations while taking part in the studies.
Counseling is important because that's where we inform them of the procedures that are expected. They are expected to participate in, of any risks, of any benefits, of any cost to them or no cost, so that whatever is done is actually made kind of public to them, that nothing is hidden. So they go through the consenting process, and it's part of the counseling we give. And counseling also helps them to make an informed decision whether to join the study or not, because it's voluntary.
Retention is a key aspect in Muju studies. Several key steps are in place to bolster retention rates for studies and trials to be successful. the volunteers need to be followed in strict accordance with the protocol. One of the ways is through Muju's Visitor Health Program, which provides follow-ups with the participants and their families in their homes. Although health visits are often scheduled, they can also be arranged. This is when there's an urgent need for participants requiring assistance. The health visitors are particularly adept at getting feedback and discussing any problem with the participants. While there, the health visitors receive feedback and discuss any problems with the participants. They're also used to track those who fail to turn up during a scheduled visit, or to collect participants when the doctor has a clinical concern that requires intervention.
The health visitors are the people who follow up participants right from the antenatal clinic when they are enrolled, from the antenatal clinic to the wards when they are admitted. They go and check on them. After delivery, they take them home. And thereafter, they are the ones who go into the home to find out, to remind them about the routine scheduled visits, if they are due. If they have missed, they go back and remind them. They go to check on them when they are sick. Say if they came and attended the antenatal clinic here and somebody was sick, we go to see how she's coping, whether she's getting better. If not, we bring the information back and then the doctor takes action.
Through such care and support, many participants report that they benefit from the personal services they receive as Muju study participants. A mother of two, Sarah volunteered at Muju 3 years ago. As a part-time laborer, she was having trouble coping with the hardships of being widowed, HIV positive, and having her young daughter test positive. Muju helped look after her welfare and provided her with counseling and psychosocial support. In addition to feeling happier and having a healthy baby, she feels good that her participation will benefit the community. 27-year-old Alan lives in Chikoni, a suburb in Kampala. She tested positive at Mulago Hospital Antenatal Clinic 3 years ago. She is a mother of 3. Muju helped her survive her pregnancy after the devastating news of her HIV result. She reports that the health visitors were instrumental in helping her to cope with the crisis. Today she is healthy. She's also a volunteer at Muju Clinic, where she looks after children in their play area.
I was so stressed after knowing that my husband is negative, but there is peer counseling, because that peer counseling can give you really how he came out through that, because him and you, or she and you were positive, you get the real person and the very, very information you need, because you can tell your friend that, do you know, I have a happy zoster here, and she come to you and say, don't worry, I was with that before, so even we take this and this and this, but you'll be fine.
The clinic at Muju is a crucial component in the administration of studies and of providing care. It serves as the area where data and information are collected from the volunteers and where the sick receive treatment, and where health workers can provide support and counseling to those in need. Several medical officers, pharmacists, nurses, health visitors, and counselors work in the Muju clinic.
The thing is that the clinic up here is basically where the participants come, and when they come, they are actually followed. So all the activities are done in the clinic in terms of collection of the data that we actually need, and that information will actually be able to help us answer the question. So we basically have all the collection of the data occur here, and then if we need to take off blood samples or breast milk for actually answering the question that we need, we actually have those services done within Muju Clinic.
Blood samples are taken routinely from the mothers to help provide clinical monitoring and care. Babies, too, are followed up to monitor the progress of the trials. Once the samples are taken, they're transferred to the Infectious Disease Institute building, where the state-of-the-art Muju Core Laboratory is located. The Muju Core Laboratory is one of the leading laboratories in Africa and performs to the highest international standards. The laboratory was established in the early 1990s. Besides Muju work, the lab is currently serving 70 studies. It carries out about 50 different tests besides the various HIV tests. The lab is certified by the College of American Pathologists, known as CAP, follows good clinical laboratory practices, and CLIA quality standards. Hence, the results that it produces are highly reliable and acceptable to the international scientific world.
There are only 3 laboratories in Africa that are CAP accredited, and we're one of them. This is testament to the kind of quality that's coming out of this laboratory.
Good quality and accurate data is important in order to ensure the validity of the studies and trials at Muju. Once the data samples are tested, the results are carefully recorded, coded, and stored. The IT department, where this is done, is equipped with sufficient capacity and backup systems. Every aspect of the studies and trials are systematically recorded and stored and eventually analyzed in accordance with the research protocols.
Well, data is at the backbone of everything because that's where we determine exactly what, in fact, the results, whether in fact a drug, if it's a drug that or whatever intervention we're using works or does not work.
A thorough quality assurance system ensures strictness and adherence to the protocols in order to achieve validity of the outcomes.
In regard to regulations, we are supposed to make sure that all IRB approvals, those are institutional review boards, we have both the local and international. We make sure that for each protocol we have all those approvals before starting the study. And we make sure that all the staff that are on board have received the necessary protocol training. And we make sure that we have all the necessary certifications for everybody. We have what we call the essential documents. And we make sure that all staff that are on board are well trained for the work that they are supposed to be doing on any given protocol.
So if any of you are signatories, never even consider
Training is a key component at Muju and helps the staff to be updated and kept abreast of the various protocols that govern research and clinical trials. Muju provides this opportunity on a regular basis to ensure the staff have the appropriate skills to carry on with work.
It's extremely important for several reasons. One, you want your staff to achieve sort of a core level of skills that they can carry on what you're trying to do. But in research it's particularly important because you have to get every aspect of the study correct. You have to do it by the protocol. If you deviate from a protocol, it's a major event. You have to write it up, document it. So we have to have it perfect. And to get it perfect, we have to have our staff trained and retrained.
Muju has in place care and support programs for the participants and their families, as well as members in the MTCT Plus programs. This is crucial in order to be able to successfully carry on research and trials.
To be able to do research, you cannot isolate care and treatment of the people you're doing the research on. And to us in Muju, we want to look at our participants and offer them holistic care. We cannot only deal with the medical bit, but we look at the social aspects. In order for our participants to be able to remain in our researches, we need to support them.
The Muju Peer Psychosocial Group is an important support mechanism. Started in 2003, it initially aimed to support HIV-positive couples in the MTCT Plus program. Today, it has been expanded to include members in all Muju study and programs. The overall aim is to improve the psychosocial well-being of the members. It also helps them deal with their social-economic well-being. Consequently, it has helped them set up income-generating projects. This program also includes the Mama and Papa Handcraft Group, which trains members to make and sell handicrafts. The profits accruing are divided among the group in order to facilitate individual projects. Other projects include book and paper bag binding and household gardening. A revolving loan scheme helps members to fund personal projects. The program also has peer educators. They help in the community outreach activities by educating the public about the dangers of HIV. They use their personal experiences to encourage and support community members to seek treatment, care, and support services.
At first they don't believe it, but after live testimonies, they realize that there is a lot lacking and that with social support, people can survive and be happy.
In 2005, the Young Generation Alive group was started in order to cater for the needs of HIV-positive children. School children receive special theme-based classes to help them better able to cope with their situation. Young children have several group activities and games to help them cope and to bond with one another.
When the children started growing up, from 3 years upward, we saw that they are also lacking social support. So we started a Young Generation Alive, and we call it Alive because now they are happy going to school and doing all the activities like any other normal child.
Without an administrative framework at MUJU, no doubt carrying out the various studies and trials that are taking place would have been difficult. The administrative arrangements, thus, have helped to smoothen the work of the scientists and the involvement of volunteers.
Basically what happens in research is the science always needs the pivot along which it rotates, and the administration, which encompasses all the program support staff, from the finance team, the logistics, the drivers, the guards, procurement. And what these people do is they provide support activities for the research studies to be carried on efficiently.
Even with the landmark successful MUJU study that led to the all-important single-dose Nevirapine intervention that is helping to reduce the risk of mother-to-child transmission of HIV worldwide, the principal investigators at MUJU are still hard at work. They continue to do the research on preventing HIV transmission and to provide the care that will improve the health and lives of families infected and affected by HIV.